So hi, today we are with our very dear patient Riya, and we are going to do something known as a hybrid PPV, in which we are going to take a part of peritoneum and a part of perineal tissue that could be penile or a scrotal and connect the whole cavity to give a hybrid mucosa to this particular patient. And let's hear from Riya that how has been her journey throughout and how she is right now here for this hybrid PPV. Over to you, Riya.
Well, the journey has been, of course, quite full of miseries, all the way right from my childhood until here. But I'm really highly excited and very curious to just have myself operated and get it done.
Super, super. And I know, and even your viewers and your Trans app, me,
The TransMe app.
the TransMe app, the subscriber of that also know that you have been through all the prerequisite of undergoing this particular surgery. And so basically there are, I know it's a guidelines, but it's a cumbersome procedure sometimes, but we have to undergo two psychiatric evaluation and the hormone therapy, social transition for almost a year before we do any irreversible surgeries. And how did you select the head and shape clinic and the PPV team? What was the research behind that?
So before, I'll be very honest, before coming down to head and shape for my for deciding about the surgery, I had been to several hospitals and the surgeons to understand the methodology and the procedures. Also, I have a lot of contacts, wherein a lot of trans girls in my friends list have undergone these surgeries.
Yes.
But hearing from them and hearing from a surgeon are two different things, and there are a lot of things involved which only a surgeon is always able to explain in a better way than any patient who has actually undergone the surgery.
Of course.
Apart from that, the best thing that I've which actually pulled me in to head and shape is the the comfortness, the family feel of all your team members, including you. Obviously, I mean, you're the
Thank
most
you.
fantastic person I've ever
Thank
met in
you.
my life. Not even for a moment did I ever feel that I'm a patient. It felt like we are a team working on me
Yes.
for my happiness.
Thank you. Thank
And it's something really great, really wonderful, because the way you have went out of the boundaries to help me out. The way your own sister Neha has come along with me to several test labs. She has waited for hours, killing her own personal time and her family life. For me, the way she has gone crossed all the boundaries. I highly appreciate. I mean, this birth wouldn't be enough for me to express
No, Riya.
all the thankfulness that I have in my heart for you guys.
So I really appreciate your kind words, but there's a soul of friendship, even from the junior most team member from Head and Shape till the expert surgeons. I'm not talking about me, but all the surgeons. Whenever we sit together, that what we want to deliver, it is something like this. We want to deliver that we want to create a very comfort zone so that any individual should not feel like that they are patients and we are surgeons. We are just a member of society, and I have some knowledge, so I'm sharing with you and I'm helping you out. It is as simple as that.
It's not that, because I really feel, because I have been to so many hospitals and surgeons myself so far, and what I have felt here, I've never felt it anywhere in the world.
Thank you. Thank you.
Anywhere in the world.
Now, for the PPV, you got admitted yesterday for the
Yes.
hybrid PPV, and
Yes.
you underwent your bowel preparation,
I did.
all the concerns and everything, and now we are going inside the theater to do the surgery.
Yes,
Okay?
I'm ready to go.
Superb. So I'll keep you posted with much more detailed videos, the post-operative videos, the intra-op journey, and eventually when everything is over, where she is in the scale of her happiness and in the scale of her satisfaction. Thank you very much. So in this particular case, we are doing a hybrid PPV. Now the reason being the lung condition of this particular case will not allow us to give long GA for more than 10 to 12 hours. So in a hybrid PPV, we use the penile skin, the scrotal graft, and the peritoneal tissue from inside. And this can be done under epidural anesthesia, 80% of the surgery, and the remaining 20% the internal work, almost 2 hours, 2.5 hours. Only that much GA will be given for the laparoscopy. So that will allow my patient to have a smooth post-operative recovery without any need of post-op ICU or post-op lung issues and fast mobilization. So let me show you what we do in a hybrid PPV. This is the urethra opening, prostate, and a urinary bladder. And this cavity which we create, that is going to be get lined by penile skin for the lower one third, for the scrotal graft in the middle one third, and the peritoneal tissue in the inner one third. So if I divide the depth of the vagina by 7.5 inches, suppose, so 2.5 inch is going to be penile skin, then 2.5 is going to be scrotal graft, and then 2.5 is going to be peritoneum. In a full-blown PPV which we do in Mumbai, in that basically we raise the whole flap, not only the hybrid PPV or we just do a bursting stitch, we raise the whole flap from inside, suppose like this, and that gets lined, the whole cavity gets lined by the peritoneal skin, peritoneal tissue, and that's a full-blown PPV, and that's why we take 10 to 12 hours, including 4 surgeons, 2 laparoscopic and 2 plastic surgeons. And that, in our experience, is going to give you more lubrication of more near normal vagina or near cis vagina, functionally, physiologically, and anatomically. Coming back to hybrid PPV, if my patients are not fit for long surgeries or long GA, we can always do hybrid PPV. I'll keep you posted. Bye bye. That's 7 inch.
Hi. So my name is Riya Singh and I was here for my SLS surgery. It's my 6th day and I'm just getting discharged. This journey, the destination of completion of my own self has been such a memory. It's so hard. It's so hard to not be overwhelmed about the entire experience that I've actually lived in the last 6 days over here. The people here are so remarkable. They never made me feel alone. They were like more than my family. I was all here alone by myself. They never let me alone, even for a moment. And they took so good care of me. It's more than a health care, where I was treated so well. And my surgery went so well. The results are so outstanding. I feel so blessed that everything happened better than I ever expected or ever dreamt about. Thank you so much, Dr. Umang Kothari and his team and the entire team of this hospital.
So coming back to today is day 14. The journey is almost ending. You have done the recovery and everything well. Today we are going to put a stent inside, which is a soft silicone stent,
Okay.
and that is going to prevent the vagina to collapse. Now this again a customized stent which we are creating,
Okay.
and we have achieved 7 inches of depth. The stent has a little tongue coming out, so you can pull it out, dilate yourself again and put the stent inside. You can roam around with the stent. You can do all your routine with the stent. The stent will avoid the cavity to collapse. It is as simple or a basic principle of plastic surgery as if in a bone contracture I remove the contracture and straighten the finger.
Okay.
If I don't apply the splint, the memory of the finger will bring it back to its original shape.
Okay.
So I want to splint it for at least 3 months to 4 months and start the physiotherapy.
Okay.
The same principle we apply when we create a cavity, that we want to stent it so that the surrounding structure again doesn't collapse the cavity.
Okay.
And we can maintain the cavity. Once the tissue changes the memory after 3 months, 4 months, 5 months, then the period for which the stent stays inside goes on a decreasing side or decreasing time. But if you keep the stent inside, you're going to have a long and a persistent cavity for longer duration. So let's start that process now.